Okay, today we'll discuss one more important topic, that is the anatomy of the pancreas as well as the salivary glands. So these are the objectives related to this topic: location, parts, relation, and peritoneal reflections of the pancreas, blood supply, nerve supply, and lymphatic drainage of pancreas, then the parotid anatomy of the parotid gland, position, shape, structure, structures within it, which are passing through it, innervation and parotid duct, then the anatomy of the submandibular and sublingual salivary glands, including their location, shape, parts, ducts, and innervation. So to begin with, the most important among these glands, that is the pancreas. The pancreas, as you know, it is located in the epigastrium, just above the umbilicus, if you see here. So above the umbilicus, this region is called as the epigastrium. So this is present in the epigastrium and upper left quadrant of the abdomen. So this will extend even to the upper left quadrant. So it begins from the epigastrium, but it continues. As you can see here, this is a horizontal gland which is kept horizontally. So it extends all the way up to the left quadrant of the abdomen, left hypochondrium. It is, as you know, it is soft lobulated elongated gland with both exocrine and endocrine functions. So it is a mixed gland with which is soft because there is no bone or something like that. It is soft in nature, lobulated as well as elongated. As you can see here, this yellow colored structure, this is elongated. Okay. It is almost 6 to 10 inches in length. If you measure from the head up to the tail, it is almost 6 to 10 inches in length and weighs around 60 to 100 grams. And it is present retroperitoneal. So it is behind the peritoneum. Retroperitoneal means it is behind the peritoneum. So it is a retroperitoneal gland. It lies across the posterior abdominal wall in an oblique direction at the transpyloric plane, L1 vertebra. Transpyloric plane, the pylorus, where the pylorus passes, that is called as transpyloric plane, and it is not exactly horizontal but slightly oblique. As you can see, this picture slightly oblique. Okay, so the head is lower down, but the tail is slightly higher up. So it is obliquely placed, retroperitoneal, and it is present across the abdomen. It is not vertically placed, but horizontally placed. If you go to the parts, it has four important parts. One is called as the head. This is the large part. This is called a head. Then a narrow part called as the neck. Then a long part that is called as the body, which is the biggest part. And the last part, which is toward the spleen. This is the spleen. Near the spleen, this is called as the tail of the pancreas. Tail of the pancreas, a very important structure. We'll talk about that. Head, then a narrow part called as neck, and a large part called as the body, and the end part toward the left hypochondrium near the spleen, that is called as the tail of the pancreas. So these are the four parts: head, neck, body, and the tail. If you study the head itself, so this is the head here. If you see, it is dish shape, lies within the duodenal cavity. So duodenal concavity, not cavity. So it lies within the cavity is here, but concavity is this one because it is C shape. As you know, the duodenum we have already studied. It has four parts: first part, second part, third part, and fourth part. So within this concavity, we can see the head of the pancreas. Okay, and related to second and third portions of the duodenum. As I said, it is related not only second and third, even to the first, second, and third. Okay, so this is the head of the pancreas. It continues with the neck on the left. It will continue toward the body as a narrow part called as the neck. So if you see the head, there is an important process called as the uncinate process. If you see here, the head of the pancreas extend downwards. This is called as the uncinate process. Part extending to the left behind the superior mesenteric vessels. Superior mesenteric vessels. You see here. So here are the superior mesenteric artery. Here will be the artery, and here will be the vein. Is the superior mesenteric vein joining with the splenic vein to form the portal vein. Here is the portal vein. So this is the superior mesenteric vein, and here will be the the splenic vein joining together to form the portal vein. Okay, but the artery will be down here. So this might be the artery. Okay, here they are shown. Okay, so this is the aorta. The big artery is the aorta, and in front of that will be the supramesenteric and artery, as well as this is the supramesenteric vein. So these vessels will be passing this structure. The head will be not the head. The uncinate process will be behind this superior mesenteric vein and the artery. Okay, so this is called as the uncinate process. This is the head, and here below this is called as the uncinate process. Then going to the neck. Here is the neck. It is the constricted portion between the head and the neck. So a narrow part between the head and the neck, very short part, which is called as the neck, lies in front of the origin of the superior mesenteric artery. So it lies just in front of the origin of the superior mesenteric. Here is the superior mesenteric artery. Just in front of that will be the neck. Okay. And beginning of the portal vein. Here will be the portal vein. As I said, the splenomesenteric vein joins with the splenic vein to form the portal vein. So just behind the neck will be the portal vein. Just a minute. Okay. The superior mesenteric vessels emerge from its inferior border, as we said. Neck will be in the front. Just below that will be the inferior near the inferior border will be the superior mesenteric vessels which are emerging. Okay, so portal vein will be just behind the neck of the panel. This is a very important relation, because in case of portal hypertension, if you want to trace the beginning of the portal vein, then just go behind the neck of the pancreas, and you can easily see the structure, which is nothing but the portal vein. Okay, now going to the body. Okay, so this is the body here. The large part, big part is the body. It runs upwards and to the left. As I said, it is slightly obliquely placed, not exactly horizontal, slightly oblique. So it runs upwards and to the left side, toward the left hypochondrium. It is triangular in cross section. If you take a section of this and see from the side, it looks like a triangle. Later, if there is any picture, I will show you later. Okay, so if you take a section of this, it looks like a triangle with the broad part towards the posterior abdominal wall. Okay, so it runs upwards and to the left, and it is triangular in cross section. The splenic vein is embedded in its posterior surface. If you see behind you see the splenic artery, it is above the body, above, just near the upper border. But the splenic vein will be behind this pancreas. Splenic vein will be behind the pancreas, body of the pancreas especially, and it is embedded within the body, posterior surface. While the splenic artery runs along its upper border. As I said, the splenic artery runs above the upper border, but the splenic vein will be behind. Okay, coming to the tail. This is the tail of the pancreas. It is narrow, short segment ending at the splenic hilum. So hilum is that structure, as you know, for any organ where the structures will enter or come out. So hilum for the spleen is this one. This is the spleen for blue colored structure, and this is the hilum of the spleen. Okay, so this tail lies near narrow, short segment ending at this splenic hilum, lies in a very important ligament called as the splenico-renal, or it is also called as the lino-renal ligament. There is a very important ligament here called a lino-renal ligament, where the tail of the pancreas will be in contact with the spleen. Okay. Okay. So it is called as the lino-renal ligament, or it is also called as the splenico-renal ligament. And this is very important clinically, as I said, may get injured during splenectomy, especially if there is any abdominal injury and if there is severe bleeding, it will be usually by the rupture of the spleen. And if you want to remove the spleen at that time, you should be very careful because the spleen is in contact with the tail by a ligament called as splenorenal ligament. So during splenectomy, that is removal of the spleen, you can cut the tail of the pancreas. And as you know, the tail of the pancreas is very important because all the islets of Langerhans are present, especially in the tail of the pancreas. Very few are in other parts, mainly they are present in the tail of the pancreas. And if you cut the tail, then it leads to the beta cells which are producing the insulin. They will be deficient, and there is something called as the increase in glucose. This because of the surgery. This is called as the induced diabetes or hyperglycemia due to induced hyperglycemia. Okay, because you are cutting the tail during the splenectomy. So you should be very careful when you're removing the spleen, because you can cut the tail and you can induce diabetes. So it lies at the level of the T12 vertebra in front of the hilum of the spleen. Okay, even though the body lies at the lower level, L1 and L2, but the tail will be lies higher up because it is obliquely placed at the level of T12. Anteriorly, it is related to splenic flexure of the colon. Anteriorly, it is related to the splenic flexure of the colon. Splenic flexure of the colon. So splenic flexure of the colon will be like this. As you can see, this is the splenic flexure of the colon. This is the colon here. This is the hepatic flexure, right flexure, and this is the left flexure, or it's also called as the splenic flexure of the colon. So here is a very close relation of the tail with the splenic flexure of the colon. Now coming to some of the relations of the pancreas, anteriorly it is related to the stomach. So if you can see here, this is the stomach, because the pancreas is behind in the posterior abdominal wall, it is retroperitoneal, behind the peritoneum. So anteriorly we can see the stomach, which is lying in front, and it is separated from this pancreas by a area called as the lesser sac, very important structure called as the lesser sac. Then we also have the transverse colon, which is in front of the pancreas, as well as the mesocolon, that is the peritoneal fold covering the transverse colon. As you know, the transverse colon is intraperitoneal because it is covered peritoneum, but not the ascending and descending. Ascending and descending are retroperitoneal, but colon, the transverse colon has a mesentery called as mesocolon. So that mesocolon will also be in front of the pancreas. So the stomach, the transverse colon, mesocolon, even the liver. Coming to the posterior relations. Posterior relations. So you have to remove the pancreas to see the posterior relation. Now here you can see here, this is the splenic vein, which is embedded, as I said, in the posterior wall. So if you lighten the pancreas, then you can see the splenic vein, which is behind the posterior surface of the pancreas. So what are the posterior relations? One is the bile duct coming from the liver. So this bile duct will be there. Then we have the portal vein. As we saw already, the portal vein. Here is the portal vein. Portal vein is formed by the superior mesenteric vein and the splenic vein joining to form the portal vein. So it will be in the posterior relation to the pancreas. Then the splenic vein throughout the body. As you can see here, this is the splenic vein. This is nothing but the inferior mesenteric vein, which is draining into the splenic vein. This is the inferior mesenteric vein. This is the superior mesenteric vein. This is the inferior mesenteric vein. So here you can see here, this is the splenic vein, portal vein, splenic vein, and the bile duct. Here is the bile duct. Okay. Then even the inferior vena cava as well as the aorta. Aorta you can see here. So here also you can see here, this is the aorta, and this is the inferior vena. This is the inferior vena cava. This is the abdominal aorta. Abdominal aorta, inferior vena cava. Both will be behind. Origin of the superior mesenteric artery. As you can see here, this is the superior mesenteric artery, which will be also behind the pancreas. Pancreas has been removed here so that you can appreciate what are the structures which are behind. Okay, then the left psoas muscle, left psoas muscle. There is a muscle here called as the psoas. Okay, psoas muscle. Then the left adrenal gland, left suprarenal gland. If you can see here, this is the adrenal gland or the left suprarenal gland. Then left renal vessels. Here is the kidney, and here are the renal vein, renal artery. Okay, all the structures are behind. So the renal vessels that will also be behind. Okay, then the left kidney is also behind. Okay, then the hilum of the spleen, as you can see, this is the spleen here. So the hilum of the spleen is also behind. All these are the posterior relations of the pancreas. Posterior relations of the pancreas. Now coming to the pancreatic duct. So we have seen anterior posterior relations. Now going to the pancreatic duct. So if you cut and see inside the pancreas, you can see this is the pancreatic duct. As you know, the pancreas is both an exocrine and endocrine gland. How do you identify the exocrine gland? By the presence of the duct. So this has a duct, so it is the exocrine. Okay, so pancreatic duct. So you can see this is the pancreatic duct. Here also you can see the pancreatic duct. The main duct of Wilson, the main duct, pancreatic duct is also called as the duct of Wilson. Okay, this is the name of the scientist who found this. Runs the entire length of the pancreas beginning from the tail. So as you can see, beginning from the tail, it runs all the way up to the head of the pancreas. It receives many tributaries from the tail, body, and neck, inferior portion of the head, and uncinate. As you can see here, there are smaller ducts which are opening into it, multiple ducts which are all opening into it. Okay, so from all the parts of the body, including the tail, body, and the head. Tail has both an exocrine and endocrine part. Exocrine part will drain into this duct. Joins common bile duct, and together they open into the hepatopancreatic ampulla of Vater in the duodenum. As you have already seen, the bile duct joins with the main pancreatic duct, and there is a dilatation called as the hepatopancreatic ampulla, or it is also called as the ampulla of Vater, V-A-T, not W, but V, Vater, in the duodenum wall as the major duodenal papillae. The major duodenal papilla here you can see. It is opening into the second part of the duodenum. The ampulla opens into the lumen of the duodenum by means of the papilla called as the major duodenal papilla, as you can see here. So here will be the ampulla of Vater, and it opens into the second part as the major duodenal papilla. Okay, there is also an accessory duct. Accessory means an additional. Okay, which is also called as the duct of Santinoni. Santironi. Okay, so this is also the name of the scientist who found that. So it is also called as the duct of the Santironi. Okay, this is called as the accessory duct. Okay, which drains the upper part of the head. If you see here, this is the accessory duct of the pancreas. So this is the accessory pancreatic duct. So this is the main duct, large duct, and the accessory duct is a smaller duct. It opens separately into the second portion of the duodenum at the minor duodenal papillae. So this also opens into the second part through a smaller opening called as the minor. Minor means small. Minor duodenal papillae, and the big one is called as the major duodenal papillae. So these are the two important openings of the pancreatic duct. Now coming to the blood supply of the pancreas. So the arterial supply for the pancreas and the venous drainage. So coming to the head and neck, so this is the head and neck. It is supplied by branches from the celiac trunk. We have already seen the celiac trunk. This is the celiac trunk, and any structure supplied by the celiac trunk should be from the foregut. So it is supplied by the celiac trunk through the superior pancreatoduodenal artery. If you see here, so there is an artery coming below. This is called as the superior pancreatoduodenal artery. Then it is also supplied by the superior mesenteric artery. So it should be also from this artery, superior mesenteric artery, is the artery for the midgut. So this is pancreas is actually developing at the junction between the foregut and the midgut. So it is supplied both by the artery of the foregut and the midgut. So foregut artery, celiac artery, supplying through the superior pancreaticoduodenal artery, and the foregut artery, the supramesenteric artery, is supplying the head of the pancreas to the inferior pancreaticoduodenal artery. Here is the superior pancreaticoduodenal, below will be the inferior pancreaticoduodenal artery. Body and tail are supplied by the splenic artery through the 8 to 10 branches. So body and the tail supplied by the splenic artery. Okay, splenic artery is which is on the superior border of the pancreas. It will supply the body and the tail of the pancreas. Now coming to the veins. What are the veins draining the pancreas? The head and neck are drained by the anterior and posterior venous arches that form the superior and inferior pancreaticoduodenal veins. So same like that of the superior and inferior pancreaticoduodenal arteries, there will be superior and inferior pancreaticoduodenal veins. So you can see here. So these are the superior and inferior pancreas. This is the superior pancreatico, then below will be the inferior pancreaticoduodenal veins, which follow the corresponding arteries. These are the corresponding arteries. The veins will follow the corresponding arteries. Body and tail are drained by the splenic vein, as we already seen the splenic vein. So it will be in the posterior surface of the pancreas, embedded within the posterior surface. So this is the splenic vein, which will drain most of the body and tail of the pancreas, drained by the splenic vein, which is tributary of the portal vein. So the splenic vein goes and joins with the superior mesenteric vein to form the portal vein. Okay. Now coming to the lymphatic drainage of the pancreas. So what are this is the pancreas, as you can see here. So this is the head, body, and tail, and here is the uncinate process. Around that there are different group of lymph nodes. So lymphatic drainage, it has a rich network that drains into the pyloric, hepatic, and splenic nodes. So there will be hepatic here. Then we have the pyloric nodes, as well as the splenic nodes. Here will be the splenic nodes. Okay, ultimately they will drain into they all come and drain into the cilia group of lymph nodes, superior group, as well as even to the superior mesenteric lymph nodes. So all will drain finally into the cilia group as well as the superior mesenteric vein. As I said, because it is developing from the junction between the foregut and midgut, so the arterial supply, venous drainage, and even the lymphatic drainage is just like that of the foregut and the midgut. By now you might be knowing what is exactly is foregut and midgut. We had discussed it before. Okay. Coming to the innervation, the sympathetic fibers from the thoracic splenic nerves. So the sympathetic will be coming from the thoracic splanchnic nerves, which will be supplying the pancreas. What is the function? Sympathetic fibers have an inhibitory effect, so they will decrease the secretions. Parasympathetic fibers are from the vagus. And what is the function? Parasympathetic fibers stimulate both exocrine and endocrine secretions. So whenever the vagus is stimulated, it increases the production of the secretion, both the exocrine and endocrine part. Okay, and the sympathetic will decrease the secretion, or they inhibit the secretion. Okay, through the thoracic splanchnic nerves. This was about the pancreas. Now going to the salivary glands. Salivary glands. So as you know, there are three important salivary glands. Okay, so the salivary glands are exocrine glands because they have ducts again, and they produce saliva, and they are around the oral cavity. There are three large named pairs of salivary glands. Okay, so there are three large paired because they are on either side, right and left side. Okay, and there are three pairs of salivary glands which are around the oral cavity, and they are exocrine glands. How do you say? Because they have ducts. Also, there are multiple minute unnamed glands in the submucosa of the oral cavity, lips, palate, undersurface of the tongue. So, because these are very minute, we will not discuss them, but there are small glands also. Okay, they are unnamed. Okay, but you should know these three important glands, which are called as the salivary glands. So the first one will be the parotid gland. So you can see here, this is the parotid gland here. Then we have the submandibular gland, which is below the mandible. So that's what is called a sub. Sub means below, mandibular because it is below the mandible. So this is called as the submandibular. Then sublingual. Lingual means tongue. So below the tongue, so it is called as sublingual. Okay, so these are the three salivary glands: parotid, submandibular, sublingual. So the parotid produces serous. So the secretion, depending on the secretion, the glands are again divided into different types. Some are serous, some are mucus, and some are mixed. So the parotid gland is a serous gland, and it is the secretion will be watery secretion. Submandibular gland, we'll go to the sublingual first. Sublingual gland is secretes saliva that is predominantly mucus. So parotid gland is serous in nature, and the sublingual gland will be mucus in secretion. But the submandibular is a mixed gland with both serous as well as the mucus secretion. Mixed gland means not an exocrine endocrine function, but the serous and mucus type of secretion. Glands are divided into different types. Exocrine and endocrine is one type. Serous, mucus, and mixed is other type of classification. You must be knowing by now. Okay, so this is mixed because it produces both the serous as well as the mucus secretion. So parotid gland is serous, sublingual is mucus, and the submandibular is mixed, both serous as well as the mucus secretion. Now coming to the parotid gland, this is the largest salivary gland. This is the largest salivary gland formed entirely of the serous acini. Okay, so this is the gland here. So this is the parotid gland, the largest of these salivary glands, and it is entirely of the serous acini. So it will be producing only the serous secretion. Position, it is bus shaped, and it is anteriorly mandibular ramus and the masseter. So anteriorly we have this muscle called as the masseter. So you can see this is the masseter, as well as the mandibular ramus. Mandible has different parts. One is called as the body and the ramus. Ramus is in the front. Okay, so here will be the ramus as well as the masseter muscle. This is the masseter muscle here. Then we have the posteriorly, it will be the mastoid process. So behind will be the mastoid process as well as the sternomastoid muscle. So this is the sternomastoid muscle, and here there will be a process called as the mastoid process, where the sternocleidomastoid muscle is attached. Okay, so deep inside, that is the bony process called as the mastoid process, and in front is the sternocleidomastoid muscle. Okay, so both are behind posterior. These are the posterior relation, and here we have the ramus as well as the masseter muscle. Masseter muscle is said to be one of the strongest muscle in the body because it helps in chewing and breaking the bones. Okay, so this is the masseter muscle. Coming to the shape, it is, as I said, it is wedge shape or triangular in shape with the apex behind the mandibular angle. Mandibular angle is between the body and the ramus. That is called as the angle of the mandible. So the apex is, this is the apex which is being below. Usually apex means at the top, but here it is reverse. Apex is below. Okay, and the base is directed upward just below the zygomatic arch. So this is the base here. Apex is below and the base is above, and it is just below. There is a bony arch called as the zygomatic arch. Zygomatic arch. So the base is directed upwards just below the zygomatic arch and in front of the external auditory meatus. This opening here of the ear is called as the external auditory meatus, as well as TM joint. TM joint between the temporal bone as well as the mandible. That joint is called as the TM joint. Okay, so TM joint. Okay, as well as the external auditory meatus are in the front. Okay, so coming to the accessory part. So this is the main gland. This is called as the parotid gland. So there is a small part which is called as the accessory part. As you can see here, there is a small part called as the accessory part. There is a small part that is separated from the main gland. So this is separated from the main gland, and it is sitting on this long tube. This is called as the parotid duct. So as you can see the duct, so it should be an exocrine gland. Coming to the capsule covering of the parotid gland, it is well covered by two important capsules. The outer one, which is tight, derived from the deep cervical fascia of the neck. The neck has a fascia called as the deep cervical fascia. Same fascia will cover the gland also. Okay. Then the inner one, connective tissue capsule. So the capsule itself form one more layer, thickens, and that form the inner capsule. The gland is divided into superficial and deep part by the facial nerve fibers. So this gland is divided into two parts, superficial as well as the deep part. I will show you later. So this is what you are seeing, the superficial part which goes behind the mandible, that will be called as the deep part. Okay, so this is the parotid duct which is opening. So this is the opening of the parotid duct. So as you can see here, this is the parotid gland, and it has a duct going into the oral cavity because it is salivary gland. So it will be opening into the oral cavity. Where it will open? So this is the papilla with the opening of the parotid duct. It opens into the vestibule. Vestibule means, what is vestibule? The space between the teeth and the cheek. So the teeth and cheek, between them, there is a small space called the vestibule. So it opens into the vestibule of the mouth on a small papillae opposite the upper second molar tooth. Just beside the second molar tooth will be the opening. There are three molar tooth, as you know. Okay, so it opens at the upper second molar tooth. Okay. Now coming to the structure within the parotid gland. So what are the structures which are passing through the parotid gland? As you can see here this is the superficial part. This is the section taken at this level, and you can see this is the parotid gland. So if you see, there is a superficial part and a deep part. Inside the deep part is the mandible. So this is the cut section and seen from above. Okay, so if you should know something called the structures passing through the parotid gland, because if there is any carcinoma of the parotid gland or something like that, any tumors related to parotid gland, at that time you are supposed to remove the parotid gland. But it is very complicated because there are important structures which are passing through the parotid gland. So you should know them and you should be able to separate them before you remove the parotid gland. So what are the structures which are within the parotid gland? Okay, that's why we study them in detail. Okay, from superficial to deep, the first structure is the facial nerve, very important nerve, which is supplying the face. If you damage this facial nerve, then it leads to paralysis of that side of the face, as you know. Okay, then it is the most superficial structure. Divide the gland into superficial and the deep one. Especially it will be sensory. It will be supplying the face, and it will be giving five branches, as you know. Okay, so it allows us the sensation, especially on that side of the face. Okay, then we have the retromandibular vein. Retromandibular vein. This is the retromandibular vein here. It is immediately in position, formed by the union of the maxillary and superficial temporal veins. So this retromandibular vein is formed by the union of maxillary and superficial veins. Okay, but if you can see here, it is within so this is the facial nerve. Then we have the retromandibular vein. As before it leaves the gland, it is divided into anterior and posterior branches that you will see in some other sections. But here you cannot see, but you can see only the retromandibular vein. Then we have behind that, there is also a very important artery called as the external carotid artery. Deep, it divides into maxillary and superficial temporal branches. Okay, so it will go above and it divides to maxillary and the superficial temporal. So it supplies the face as well as the temple. Okay, the skull. Then we have the most deep branches also. Okay, so these are some important branches, important structures which are passing through it. One is the facial nerve, retromandibular vein, as well as the external carotid artery. So there are three important: one artery, one vein, as well as one nerve are passing through the gland. So we should be very careful when cutting the parotid gland itself, if there is any tumor or something like that. Now you can see here, this is the facial nerve. It is supplying, giving 5 branches, and it will supply the skin of the face, sensory nerve. Okay, so these are the 5 branches: temporal, zygomatic, buccal, mandibular, as well as the cervical branches. So 2 branches will be before its entry into the gland. So if you can see here, it is already before it enters, it will give 2 branches. Then it will give 5 branches within the gland. Okay, 5 branches within the parotid. One is temporal, zygomatic, buccal, and mandibular. As you can see here, this is how it gives. Okay, this is how you represent temporal, zygomatic, buccal, mandibular, as well as the cervical branches. These are the 5 branches which are within the parotid gland. So if we are removing this gland, you should be very careful that you should not damage. If not, that side of the sensation will be lost. Now coming to the parasympathetic innervation of this parotid gland, it is from the inferior salivary nucleus. Inferior salivary nucleus. Okay, so it will be giving tympanic nerve, and this tympanic nerve through the glossopharyngeal nerve to the tympanic plexus, and from there lesser petrosal to the otic ganglion. You can see here, here is the glossopharyngeal nerve. This is the ninth cranial nerve. Okay, so it is coming from the salivary nucleus, the inferior salivary nucleus, through the tympanic nerve, and here you can see here, this is the tympanic nerve. Okay, through the glossopharyngeal nerve. So the tympanic nerve comes through the glossopharyngeal nerve, then to the tympanic plexus. If you see here, here is a plexus of nerves called as the tympanic plexus, and through the then through the lesser petrosal nerve to the otic ganglion. Here you can see this is the otic ganglion, and this is the lesser petrosal nerve. It comes all the way. So this is the coming from the, so this is the parasympathetic component, preganglionic, then the postganglionic. So it will relay in the otic ganglion, the postganglion fibers running in the auriculotemporal nerve. So now the postganglion fibers, which are coming from here, they will pass through the auriculotemporal nerve to innervate the parotid gland. Then coming to the, this was about the parasympathetic. Now coming to the sympathetic. Sympathetic from the plexus around the external carotid artery. As you saw the external carotid artery before, so it is here. This is the external carotid artery. Okay, which is passing like this in the vertical direction. So around the external carotid artery, there are some nerves around it. So the plexus around the external carotid artery supplies the parotid gland. So this is the parasympathetic component, and the sympathetic component will be around the external carotid artery. So it will be supplied by both the parasympathetic and parasympathetic, sympathetic and parasympathetic components. So it is autonomic nervous system. Now coming to the arterial supply, it is supplied by, now you can see here, this is the external carotid artery which is passing through the parotid gland to give the maxillary artery and the superficial temporal. Superficial temporal, and here is the maxillary artery. So here, okay. So this is the maxillary artery shown, and here is the superficial temporal. So this is the external carotid artery, around which is the sympathetic plexus. Okay. So this is the external carotid artery and its branches, which will supply the parotid gland because it is passing through it. The venous drainage is through the retromandibular vein. Now you can see here, this is the retromandibular vein coming all the way, and it will drain here into the external jugular vein. So this is the retromandibular vein formed by the maxillary vein as well as the superficial temporal vein. Okay, so this is the retromandibular vein. Then we have the lymphatic drainage of the parotid gland to the parotid as well as deep cervical lymph nodes. There are a group of lymph nodes here called as parotid, and also they will all drain, everything from the head and neck as well as the neck will drain into the deep, finally into the deep cervical lymph nodes. So this also parotid gland also drains into the deep cervical group of lymph nodes. Now going to the submandibular salivary gland. So here is the submandibular salivary gland. So it is located deep to the body of the mandible, because it is deep to the body and below the mandible. That's what is called a submandibular. Okay. So the parts, again, this also has a superficial part which is seen from outside. Okay, superficial part is what you are seeing here. This is the superficial part, and the part which enters, if you can see here, the deep part has entered here. So here is the superficial part, and the deep part is, this is from behind, and you are seeing inside the oral cavity. So this is the deep part. Okay, so this is the deep part, and the superficial part is going outside because you are seeing from inside. Okay, so this also has a superficial and deep part. Okay, so the larger part is the superficial part, which is outside, and the deep part, which is small part, is inside. And you can see the duct coming from the this gland, that is the submandibular gland. So this is called as submandibular duct. So the duct indicate that this is also exocrine. So here you can see again, this is the submandibular gland. So this is the superficial part which is outside, and you are seeing from inside. So this is the deep part, and this is the submandibular duct. So the submandibular duct, the duct emerges from the deep part of the gland. As you can see here, it is emerging from the deep part of the gland. It passes forwards along the side of the tongue under the mucous membrane of the floor of the mouth. So it will goes under the tongue and beside the tongue. It crosses laterally by the lingual nerve. So if you see here, there is a nerve passing through here. So here, okay. So this is the lingual nerve. Okay. So it is crossing the lingual nerve. It opens on the summit of the small sublingual papillae, which lies at the side of the frenulum of the tongue. So this is the central. This is called as the frenulum of the tongue. If under surface of the tongue, if you lift the tongue, you can see at the center there is a septum called as the frenulum of the tongue, and just beside that you can see here, this is the submandibular duct, and then the small opening here. These are called as the opening of the submandibular ducts. These are the openings on just beside the frenulum, either side, because it is in pairs, both right side and left side. So they open just beside the frenulum of the tongue. Clinically, it is important to remember that submandibular duct can be palpated through the floor of the mouth alongside the tongue. So you can palpate this duct alongside of the tongue, as well as you can even trace the openings of this duct just beside the frenulum. Saliva can usually be emerging from the orifice of the duct. If you lift the tongue and see, you can see the small quantity of saliva coming into the oral cavity through this openings. So this is also the site for formation of callus formation. The submandibular duct is common site of callus formation because it has to go and drain against the gravity, as you can see here. So this duct is opening like this, going above and opening above. So this is more prone to develop callus stone formation. Okay. So the submandibular duct is common site for callus formation. The presence of tense swelling below the body of the mandible, which is the greatest before or during a meal, is reduced in size or absent between meals in the diagnosis of the condition. If you can see here, there is formation of a tense area because of the callus formation. Examination of the floor of the mouth will reveal the absence of the ejection of the saliva from the orifice of the duct on the affected side. And you can see here, if you observe closely, you can see, if you see closely, there will be no ejection of the saliva because of the callus presence. Okay. So a small calcified stone blocking a salivary duct is visible as a yellowish mass here, circled in the center of the mouth of the mouth. Okay, so there is a callus which is blocking the duct, and you can, if you closely look into it, so there will be no absence, there will be absence of the ejection of the saliva through this duct. Okay. Frequently, the stone can be palpated in the duct which lies below the mucous membrane of the floor of the oral cavity. So if you palpate it, try to palpate near the frenulum, just beside the frenulum. Okay, then you can feel sometimes the stone also. Now coming to the last gland, that is the sublingual gland. As the name indicates, it is below, just below the tongue, so that's why it is called a sublingual. the smallest of the three salivary glands. This is the smallest of the three salivary glands. It lies below the mucous membrane on the floor of the mouth, close to the midline. So it lies close to the midline, and it is in the floor of the mouth. Okay. So here, hmm, so here you can see here. This is the submandibular sublingual glands. Okay. And also you can see the ducts. Okay. So this is the submandibular duct beside that, and this is the sublingual. Okay, they are very close. Submandibular, this is the sublingual. Okay, and this is the lingual fold along the saliva sublingual gland. So here also you can see the same thing. This is the sublingual fold, and here you can see the submandibular gland duct as well as the sublingual papillae. And they are beside the frenulum. Frenulum is this the center at the center. Okay. The submandibular duct are 8 to 20 in number. Parotid had a single duct on either each of the parotid gland had one duct. Submandibular gland also had one each, but the sublingual has multiple, 8 to 20 in number. There are small openings, multiple openings. Okay. Most open into the summit of the sublingual fold, but a few open into the submandibular duct. So some open into the sublingual fold and some open into the submandibular duct. Okay. Coming to the blood supply of the sublingual gland, it is supplied by the facial artery, and the venous drainage is by the facial vein. So this is the facial artery coming from the external carotid artery, and here is the facial vein. So this is the facial vein draining. So it is very close to the sublingual gland, and it will drain the submandibular sublingual gland. Okay, supplied by the facial artery, drained by the facial vein. Lymphatic drainage will be into the submandibular group of lymph nodes. There are group of lymph nodes near the submandibular gland, that is called as submandibular group of lymph nodes. Finally, all these will finally drain into the deep cervical group of lymph nodes. Now coming to the nerve supply. Nerve supply similar to that of the submandibular. This is also supplied by the parasympathetic and the sympathetic. Parasympathetic secretomotor from the superior salivary nucleus. There, for the submandibular, it was inferior salivary nucleus. Here it will be the superior salivary nucleus, and it will be passing through the seventh cranial nerve, that is the facial nerve. Okay. The fibers passes through the submandibular ganglion via the chorda tympani nerve and the lingual nerve. If you see here now, so here this is the otic ganglion, and this is the chorda tympani. Okay, and the superior salivary nucleus will be here, and these are the parasympathetic sympathetic fibers which are passing all the way. Okay. So the fibers to the submandibular ganglion via the chorda tympani nerve. So it will be passing through this chorda tympani nerve. So this is the seventh cranial nerve, facial nerve. Okay. And the lingual nerve. Finally, it will go through the lingual nerve. Here is the lingual nerve. So here is the lingual nerve, and this is the chorda tympani nerve. This is the facial nerve. So this is all the process through which it will be passing. The postganglion fibers reaches the submandibular and the sublingual gland either directly or along the duct. So here is the submandibular ganglion. So they will all these fibers will come and relay here, and the postganglion fibers will start from here. Postganglion fibers reach the submandibular and the sublingual gland either directly or along the duct. So this submandibular ganglion will supply both the submandibular as well as the sublingual through its postganglion fibers. You see here, these are the postganglion fibers. These are the postganglion fibers for the otic ganglion. Okay, so here was the otic ganglion. Here it will be the. So here similarly we have the submandibular ganglion, and from here we can see the fibers, postganglion fibers coming from here. Okay, so here these are the pre-ganglion fibers and these are the post-ganglion fibers. So post-ganglion fibers will be coming from the submandibular ganglion and they relay in the submandibular and sublingual glands. For the parotid, it will be the otic ganglion which is important, which we have shown all the process here. Okay, for the parotid, and for the submandibular and sublingual, it will be through the superior saliva nucleus, and from there into the facial nerve through the chorda tympani, then the lingual nerve, and they're relaying the submandibular ganglion, and the postganglion fibers will start from here, and they're relaying the sublingual and submandibular glands. So this is all about the three glands, that is the three salivary glands, parotid, submandibular, and sublingual, as well as the pancreas. So if you have any doubts regarding this, you can ask me now. Any doubts? Okay, thank you.